Support for Louisiana, the state we're in, is provided by
Entergy Louisiana is strengthening our power grid throughout the state. We're reinforcing infrastructure to prepare for stronger storms, reduce outages, and respond quicker when you do need us, because together we power life.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
The latest news on the insurance crisis.
April is Donate Life Month. We'll bring you the story of a Louisiana organization working to save lives.
And a report paints a grim picture of Louisiana's reproductive health landscape.
It's strawberry season, and we'll explore the unique traditions tied to the berry. Are you ready?
I'm ready.
Let's do this.
All right. Hi everyone, I'm Kara St. Cyr.
And I'm Karen LeBlanc. Much more on those top stories in a moment on this week's edition of Louisiana, the state we're in. But first,
many people in Louisiana are scrambling to make ends meet as their homeowners insurance premiums skyrocket. After a series of storms caused major damage across the state, more than 20 insurance companies left Louisiana or refused to take on new customers. Now lawmakers are at odds over ways to help homeowners cover their rising costs.
I started preparing in the inside, in my closet, And I started telling my sons, I said, some of us, we are going to get in the closet, and some can get in the bathtub or in the hallway, to protect ourselves.
Hurricane Ida barreled through South Louisiana as a Category 4, devastating homes and businesses. In New Orleans, Janet Tobias didn't evacuate. She stayed inside her house in Uptown.
Window panes all around that was blown out from the wind. Thank God we didn't have roof damage, and some of the porch rail that was broken because of the wind.
The damage to Tobias' house was minimal. Window panes and porch rails were an easy fix. The real problem was her homeowner's insurance rate.
I did not expect any prices to go up. For 1 year, I was paying $2,000 before Ida. And then after Ida, I started paying $4,000. Now I'm paying $11,000, close to $12,000, $11,700 for the same home.
Tobias' insurance company, Americas, went under after the storm, leaving Tobias with few options to choose from. Her new policy would steadily increase, a little over $2,000 each year, with a near $6,000 increase from 2023 to now.
How are you managing paying almost $12,000 for homeowners insurance?
It is a big hardship because our quality of life have changed. We was able to travel a lot. I can't do that anymore.
Tobias' story isn't uncommon. After Hurricane Ida, more than 20 insurance companies went belly up or refused to write new policies, leaving people like Tobias with only a few companies to choose from and an ever-increasing policy rate.
The legislation that we're bringing, that you will see brought to the Capitol, it's not experimental.
Louisiana's newest insurance commissioner, Tim Temple, proposed a slew of insurance company-friendly bills aimed at reducing restrictions. Temple says the bills will create competition and level out skyrocketing premiums in the process. 4 bills from Temple's agenda gained favorable majority votes in the Senate Insurance Committee: Senate Bill 323, Senate Bill 250, Senate Bill 295, and Senate Bill 370. The first limits the penalty insurance companies pay if a judge finds they've purposely avoided paying a policyholder what they owe. The second removes the insurance company's name from a lawsuit if the company isn't directly being sued. The third allows insurance companies to raise rates without going through the insurance department first. And the last would eliminate Louisiana's unique 3-year rule, which keeps insurance companies from dropping policyholders if they've been with the company for 3 years or more. Each bill sailed through committee, but not without criticism.
it still is of a real concern to me that everything is done to favor the insurance industry with no guarantees that it's going to lead to a reduction in rates.
Democrats on the Senate committee questioned how Temple's package would actually help consumers and the state out of an insurance crisis.
How long do you think it would be before we are able to see the results of the impact of this legislation? Do you think a year, 2 years? How long do you think it would take before we can kind of see whether or not this is working?
Well, I know my predecessor liked to give guarantees, and I'm not going to go down that path. But look, there is no known definitive.
Senator Adam Bass, the sponsor of Senate Bill 370, says creating competition is the only way to level the playing field for consumers.
The bills that I voted on for in committee are pieces of that puzzle that I think overall will make us more competitive and attract more insurers to do business in the state of Louisiana.
But back in New Orleans, Tobias is hoping lawmakers' decisions are in her best interest.
So if they can help them or talk to them about adjusting the prices to spread them out more within a year's time.
If you want to learn more about the insurance industry, make sure to watch this month's Spotlight, Priced Out, Inside Louisiana's Insurance Crisis.
Well, the insurance crisis certainly is on the minds of many across Louisiana, especially since the legislature is in session.
Of course.
And also on the minds of many. From hashtags to headlines, here is what's trending this week. So a cargo ship slammed into the Francis Scott Key Bridge earlier this week in the early morning hours. The bridge collapsed. And that's got people talking all across Louisiana just about, we got a lot of bridges here.
So it begs the question, is our infrastructure up to bat? And if something like this were to happen in Louisiana, how would we be able to cope with that?
Absolutely.
So moving on again, talking about big news in Louisiana. The Bachelorette is officially a Louisiana girl. She's from New Orleans. Her name is Kelsey Anderson, and she got that final rose.
That's right. Her fiance, Joey Grazade, proposed. And I got to tell you, my 80-year-old mom is a super fan of The Bachelor. She made me sit down with her and watch the finale this week.
Okay, so you think that they've got real chemistry?
I do, actually. She just looked joyous. They really did look in love. But I always feel sorry for the losing Bachelorette.
I know, you make it all the way to the very end just for him to not give you the rose. I don't know what I would do. I probably wouldn't even leave the set.
And then
you have to give me this rose.
She's so in love, and her heart gets broken. But there again lies the success and the plot line of the show.
Congratulations, Kelsey.
Wedding bells coming soon. So that's some good news for the Bachelor and Bachelorette, the happy couple. Also, moving on to good news across the state. April is National Donate Life Month, calling attention to the life-saving role of organ donation. Across Louisiana, more than 2,000 people are on the organ transplant list, waiting for the call as time ticks. The Louisiana Organ Procurement Agency, known as LOPA, is a nonprofit focused on community outreach and works with families to find organs and tissue for transplant. I'm introducing you to one of LOPA's tireless volunteers traveling the state to share her story. Thank you. Well, Wendy, thank you so much for inviting me into your home to chat about your organ transplant journey. Take me back to the beginning of your journey with organ transplant.
Okay, well, I was 18 years old and I was not feeling well, and my mom took me to a doctor and they did some blood work and found out that I had a rare autoimmune disorder, a liver disease called primary sclerosing cholangitis. I had a liver biopsy, and that's kind of where my journey began. And the doctor told me that one day I would need a life-saving liver transplant.
At age 40, Wendy Haspel-Lipsy needed a new liver. It was 2007, and doctors put Wendy on the liver transplant waiting list.
I waited 2 long years, and finally in 2009 I received the call that they had a perfect match for me, and I needed to hurry up and get down to Oxnard. My donor, his name is Christian. He is my donor hero, my donor angel. He was 16 years old when he passed away, and he made the decision to get a heart on his license to save lives. And I am so grateful for his gift. And I wrote a letter to his mom about a year after my transplant to thank her for this gift. And my mission is to spread organ donation awareness, talk about my hero Christian, and live his legacy, live my life to the fullest. thanks to the gift of organ donation through Christian.
Wendy volunteers with the Louisiana Organ Procurement Agency, serving as vice chair and a certified public speaker. She travels the state to spread the word on the importance of organ donation.
In the state of Louisiana, 2,000 are waiting on a life-saving organ, and of those 2,000, 1,700 need a kidney.
The nonprofit does community outreach, educating people on the importance of organ and tissue donation, and worked with the Louisiana legislature to pass Allie's Law.
We worked with the family of Allie Renge. She was killed in a car crash, and on Christmas Day in 2021, she gave 5 people Christmas miracles. We worked with lawmakers. We went before the Senate Education Committees. We worked with Bessie. It passed. The governor signed it in 2023. And so now in all the high schools, before high schoolers graduate, in a required class, they will learn about organ tissue and eye donation.
What was fun about this party is that we never thought I would reach the age of 50. Being so sick most of my life.
In 2015, Wendy needed another organ transplant, this time a liver and a kidney, after her body rejected the first transplanted liver. She was put on a waiting list and, given her critical condition, received both within days.
Literally on the brink of death. Literally, 72 hours from death, maybe even less than that. I was in a coma, very jaundiced, lifeless. And within that 72-hour period, the doctor came in the room and said, "We have a match for you. We have to go out of region, out of state, but if surgery is a go, liver and kidney look good, we'll have surgery tonight at 8 o'clock.
Today, Wendy honors the legacy of her organ donors by living her life to its fullest and raising awareness of the life-saving gift of organ donation.
I spent a lot of my life in this office doing volunteer work and planning the FADO Donate for LOPA, so this is my desk where I sit, and just some fun little pictures with my son Luke, with my 2 dogs, Owen and Teddy. They're my little loves. Hanging out with the women's basketball team, you know, go Tigers and Kim Mulkey.
Wendy and her son Luke are supporters of the LSU women's basketball team. Her son is president of the team's Fast Break Club. Wendy, she doesn't miss a game, and you can't miss Wendy, dressed in sparkle outfits emulating Coach Kim Mulkey's signature style. The LSU women's basketball coach is a supporter of LOPA.
You can be a champion. You can do it through organ, tissue, and eye donation.
And our goal is to get you educated before you leave high school, that you know a little bit about organ tissue and eye donation. We also try to get you in the driver's ed classroom and then at the OMV. So our goal is to educate, and if you can help us do that in any way, you can invite us in to be a speaker. You can hopefully you'll join with us and you'll take action to be a donor.
April is National Donate Life, and approximately 100,000 people nationwide are waiting for a transplant. Wendy is sharing her story as living proof of the power to save lives through organ, eye, and tissue donation.
My house was representative of who I am. The colors, the butterflies are a big sign of organ donation, and that's just kind of how I live my life, just colorful and, you know, living out loud.
The LOPA Foundation is hosting a fundraiser. It's called FADO Donate on April 27th. For more information, you can go to lopa.org/FADO Donate.
In a post-stroke country, women are faced with new challenges seeking reproductive health care. Just this week, the Supreme Court heard a case involving the abortion access pill mifepristone, which could further change the reproductive landscape. A new report looks at the lengths doctors are having to go to provide the best care possible while staying within the bounds of the law. I spoke with Michelle Ehrenberg, the executive director of LIFT Louisiana. Take a look. First off, I want to say thank you so much for joining us.
Thanks for having me.
So we're going to jump directly into this report. So why did you decide to collaborate with other groups involved with this project to study the results of the Dobbs decision?
Well, we thought that it was critically important because what we were hearing more and more from both patients and physicians was that the abortion bans were having an impact on the way that pregnancy care was being provided in the state of Louisiana. There had been multiple news stories of patients not receiving timely access to care, even having to travel out of state to receive the care that they needed. And so we thought that it was really important in this moment really to to undertake the research and actually document the impact.
What were the key findings and how did that affect women's health care currently?
Well, I think one of the things that is really important to note is that the abortion bans have really had an impact on the provision of pregnancy-related care. So this is not necessarily even focused on people who are seeking abortions, but actually people who are carrying wanted pregnancies that are dealing with pregnancy complications and that are finding that care being delayed or even denied in some circumstances. And so I think that that's one of the really critical findings in this report. And also just the amount of confusion and fear that physicians feel as it relates to what care they can provide, at what point they can provide care, and it seems to have had a very sweeping impact on what would normally be sort of best standards of practice in pregnancy care because there's so much fear and uncertainty about what physicians are allowed to do or not allowed to do under the current law.
I did notice that the report did focus highly on physicians and healthcare providers. So can you give me an example of a situation where a healthcare provider may be afraid to give some sort of level of care that maybe they would have given before the Dobbs decision?
Yeah, so we heard a lot from physicians. Almost all physicians talked about or expressed situations in which either they themselves or colleagues were delaying access to care. So, for example, there's a story that's recounted in the report about an ectopic pregnancy situation in which it was very clearly an ectopic pregnancy, but the care for that patient was delayed and they were asked to come back, and because they just wanted to make absolutely sure that they could terminate the pregnancy without the repercussions or being perhaps misunderstood to have provided an abortion in violation of the law.
So there's a lot of fear and anxiety around, okay, I could possibly be penalized for performing X, Y, Z.
Right, exactly.
And so, I mean, how did the findings in this report to compare to other states that have passed similar legislation?
Well, I think that what this report shows is what's happening in Louisiana for sure, but we think that this is probably just a microcosm of what's happening around the country in other states which have banned abortions. And our hope is that other states will undertake similar research so that we can get a better picture of the impact, across the nation of these abortion bans. But we did choose to focus here on Louisiana because we have some of the most restrictive abortion bans in the state with very, very, very limited exceptions. And even in the circumstances in which there are exceptions, it's very unclear as to when a provider can perform a pregnancy termination, otherwise known as an abortion, and still be within the bounds of that law.
Well, there were a lot of recommendations that were presented in this report to help with these poor health outcomes. I guess, in your opinion, which one is the most important that you think Louisiana should adopt?
Well, I think there are several that would address, I think fundamentally just repealing the abortion bans would be the most important thing. But we also recognize that there's not a lot of political will at the Capitol to do that right now. But there are several proposals, even in this legislative session, that would make modest changes to the existing abortion bans that would give medical providers a little bit more discretion and sort of untie their hands to make decisions in the best interest of the care of their patients when it comes to miscarriages or other serious health complications.
And there is another thing that I wanted to ask that was in that report. One of the report's findings is that doctors are having to resort to much more invasive surgical options like a C-section whenever other procedures could have had the same outcome with far less risk to the mother. Is that something that is true in other states, or is that something that's focused mainly in Louisiana?
We're not really sure, but this actually was one of the most surprising findings for us in doing this research. And there's one particular story that's recounted in the report, but we actually heard 3 or 4 different stories from physicians in which the provider opted to perform a C-section rather than perform a procedure that would be much less invasive, what's usually called a dilation and evacuation procedure, which is the exact same procedure as an abortion. And so there's one story that was relayed to us from a physician in which a patient's water broke at 20 weeks, and so the pregnancy was no longer viable at that point. And if the patient had been asked or forced to carry that pregnancy further along, it really would have put their health and life at risk. And so normally a doctor would consult with the patient and give them several options. One would be the dilation and evacuation procedure, or they could induce labor and have a vaginal delivery. But the last and most significant option would be a C-section, which is severe, very serious abdominal surgery and has a lot of implications for future pregnancies. But yeah, we heard three different stories of situations in which the patient wasn't even being given an option of what to do in that circumstance.
All right, well, thank you so much for sitting down with us. I appreciate it.
Thank you.
Mardi Gras season ranks as Louisiana's largest party, and the annual Ponchatoula Strawberry Festival comes in second as a popular crowd pleaser, attracting more than 300,000 people. Now in its 52nd year, the festival coincides with the start of strawberry season. I traveled to Ponchatoula to explore its claim to fame as the strawberry capital and Louisiana's unique traditions tied to the berry.
1,500, 1,600, 16 to bit, 16, I got 15, 16. Here's your champion berries, the grand champion berries of the Strawberry Festival for this whole year.
The first strawberries of the season are up for bid. Some of these prize-winning flats command upwards of $1,600. The Friendly Strawberry Farmers Competition is a community fundraiser and a prequel to the popular Ponchatoula Strawberry Festival.
So how do you tell the real deal, a strawberry from Ponchatoula as opposed to any other strawberry?
Oh, easy. Okay, the best way is to just take the berry, slice it in half. If it's red all the way through, it's a berry from Ponchatoula Parish. And if it's really red, it's from Ponchatoula. Any other berry is going to be white on the inside.
The strawberry is synonymous with Ponchatoula, the self-proclaimed strawberry capital. The town proudly displays its ties to the berry with sculptures, murals, and business monikers.
In years past, we probably shipped more berries out of Ponchatoula than any other community. But then as the farmers begin to retire and sell the land to developers, there's only a few real farmers left.
Although no longer the primary cash crop of Ponchatoula, the town continues to capitalize on the berry as part of an emerging agritourism industry in Tangipahoa Parish.
Agritourism really is a big impact on us in our area, and it's so much more than just the strawberry farms. We have our pumpkin patches. We have our tea farm out from Amite, Louisiana, and it's the only tea farm in Louisiana. We're just finding more and more that people just really want to be engaged and go behind the scenes and see where their foods come from. We claim to have the sweetest berries that there are all around, and then our festival. It is just something that's iconic. People travel here from all around. They want to be a part.
The strawberry is also a cultural treasure in Tangipahoa Parish, complete with its own court of royalty, kings and queens, who serve as Ponchatoula Strawberry Festival ambassadors, wearing the strawberry crown and sash.
My mom was Strawberry Queen, so I knew I wanted to do it. I competed twice in the pageant, and I mean, there's so much. I talk to strawberry farmers, go to the farm, figure out the whole process. You got to know a lot about strawberry farming.
Strawberry is in my blood. Born and raised, grandparents were farmers, my dad was a farmer. I grew berries. I mean, it shaped me into, I guess, throwing my community support behind something that's raising a lot of money for the community. Come out, support us, and help support the community and support the strawberry farmer, number one. Number two is your nonprofit organizations that are out here on the grounds making money.
Spoken like a regal king.
Strawberry Day leads up to the main event with a bake-off, chicken wing cook-off, and a car show, all aimed at raising funds. The Ponchatoula Strawberry Festival is celebrating its 52nd year, a tradition born from the community's legacy of strawberry farming dating back to the early 1900s.
In 1901, Mr. Klondike came along with the Klondike berry he'd been playing with for several years, and it was a very fragile berry, and so it couldn't ship very well until about 1910 when the refrigerated cars came along. But back in the early 1900s, we had somewhere 1,060 farmers, strawberry farmers, and now we're down to maybe 6. So it really changes a lot since then.
Those thousands of strawberry farmers credited with giving Ponchatoula its claim to fame, their names are chronicled here in front of City Hall on the Ponchatoula Strawberry Farmers Wall of Honor, and these names date back to the late 1800s.
Strawberry production peaked in the 1930s. During the heyday of Ponchatoula's strawberry production, the school year would revolve around strawberry picking season.
We started in July because we let out of school in March so that all the kids in the area could pick strawberries. And so because of that, the Department of Education would use the Ponchatoula schools as test schools for the first lunch, the first breakfast for kids, the first distributive education program for businesses.
With strawberry season starting in March, around town you can find strawberry farmers selling flats freshly picked from the fields.
Of course, I could not come to Ponchatoula without purchasing my own flat of homegrown strawberries, so I'll take one.
All right, you can pick out whichever one you'd like.
I'm going home to make some strawberry shortcake.
The Ponchatoula Strawberry Festival takes place April 12th through the 14th at Ponchatoula Memorial Park. An interesting tradition I discovered was the strawberry auction. These prize-winning strawberries were commanding $1,600 for a flat.
What's the criteria to win?
Good question. So they have to be large berries, red all the way through, and of course, sweet.
Okay, well, I'd imagine they tasted really good. I wouldn't know because Karen didn't bring any back for us. So I won't know.
I know.
I hope everyone at the Strawberry Festival enjoyed their strawberries.
Well, I'll go back to the Strawberry Festival. We have time. It's April 12th through the 14th. I'll take orders from the station and bring them back. How about that? Are you happy now?
I am happy now.
All right. Well, that is our show for this week. Remember, you can watch anything LPB anytime, wherever you are, with our LPB app.
You can catch LPB news and public affairs shows, as well as other Louisiana programs you've come to enjoy over the years. And please, like us on Facebook, X, and Instagram.
For everyone at Louisiana Public Broadcasting, I'm Karen LeBlanc.
And I'm Kara St. Cyr. Until next time, that's the state we're in.
Support for Louisiana, the state we're in, is provided by
Entergy Louisiana is strengthening our power grid throughout the state. We're reinforcing infrastructure to prepare for stronger storms, reduce outages, and respond quicker when you do need us, because together we power life.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana.
And by Visit Baton Rouge and the Foundation for Excellence in Louisiana Public Broadcasting and viewers like you. Thank you.